I now recognize Ms. Dingell for 7 minutes of questions.
Thank you, Mr. Chairman and Ranking Member Ruiz. Let me begin. I first will tell you I'm wearing a mask because I got COVID last Thursday, the day the public health warning expired. I was fully vaccinated and boosted. My symptoms weren't pleasant this time, but I wasn't hospitalized. I tested negative yesterday and today, but I'm wearing the mask following CDC guidelines because I don't ever want another person to get COVID if we can keep it from happening. And to all of you, your stories are horrific, but I've heard them over and over, and they're not unique to New York. They're stories that I started hearing in March, April, May, at home as well. And they shouldn't have happened, period. It's simple. We were not ready for the pandemic, let alone were our nation's nursing homes ready. And it's troubling because our nation's seniors are important and they're deserved and entitled to live their senior years in dignity and with respect. And no life, for the record, is expendable. No life. Unfortunately, because we weren't ready, the country was not ready, and previous administrations' haphazard federal responses, and we're pointing a lot of fingers, and we need to understand why what happened happened so it never happens again. Because we did fail this nation. We failed our seniors, and we failed their families. Let me talk about Michigan. We were hit very hard. The Detroit News has been running a series of stories on this in the last couple of weeks. And among their observations, according to the documents released by the government, the problems largely occurred amid a shortage of personal protective equipment for staff at nursing homes, sometimes hospitals, as well as a short supply of COVID-19 tests. Melissa Samuel, the president and CEO of the Healthcare Association of Michigan, said facilities did all they could with the resources and knowledge available at the time to provide the best care for their residents. Healthcare workers and many others stepped up and risked their lives to care for COVID patients. As the world sheltered in place, dedicated, exhausted, frightened healthcare staff kept showing up hour after hour, day after day, to care for those in need. Healthcare workers and thousands of others saved countless lives during this unprecedented, unimaginable time. But, as you all just talked about, too many died. I got an early glimpse in many of my cities. Riverview, Michigan. I heard from everybody. I heard from the mayor. I heard from the fire chief because of the number of runs he was having. I heard from the relatives of the Rivergate residents and the healthcare workers. They repeatedly lodged formal complaints against the Rivergate facility in the spring of 2020 for failing to properly identify and combat a spike in COVID-19 infections. A self-identified registered nurse estimated that close to 100 patients had the coronavirus at the 168 resident Rivergate Terrace, and 7 workers had been sent to the hospital, according to an April 9th, 2020 complaint. The nursing home did not have protection. They didn't have masks, they didn't have gowns, or tests to keep them safe. I emptied my garage, I'm a hoarder, of every garbage bag I had. I went to the schools and the businesses who had shut their doors and begged for garbage bags. And those nurses or those attendants wore black garbage bags as gowns. I took a collection of gloves from every place I could procure them from. And I worked with the governor's office and the autos and was making calls to China, begging, spending millions of dollars on PPE equipment to get it shipped, but had to find somebody we knew and trust to go look and inspect it to make sure it had quality. And to make matters worse, the PPE that many states were receiving from the Strategic National Stockpile was expired, with dates as far back as 2010. We need to work on that. That's one of the things this committee must do, and that in conjunction with the Energy and Commerce Committee, to make sure we are never ill-prepared as we were, and that this never happens again. Now, I have a couple of questions. Dr. Grabowski, can you explain how your research found that troubling correlation between community infection rates and nursing home outbreaks? And could you try to do this quickly, because I have a lot of questions.
Absolutely. We looked at a lot of different factors, and the strongest predictor of whether or not a nursing home had COVID was a COVID outbreak in that community. And it's because the staff were living in that community and working in the nursing home, and that was the pathway.
If nursing homes had been able to receive timely and adequate supplies of PPE and testing kits, would that have had a meaningful impact in terms of reducing unnecessary infection and death?
Absolutely. Our work showed huge shortages, 1 in 5 facilities, even during the summer of 2020. Very few had access to rapid testing. A really important study a few weeks ago came out in the New England Journal of Medicine suggesting that more access to rapid tests led to fewer resident fatalities. The link is very strong.
So I want to build on something you talked about earlier, the crisis on top of the crisis. The previous administration oversaw years of rollbacks on federal regulations related to the quality of care and infection prevention in nursing homes. This was severely felt in nursing home like the one in Riverview. And I'll tell you another story. In Ann Arbor, I had someone call me, and they had 12 patients and nobody to care for them because the healthcare workers were sick and wouldn't come in. Nobody. Do you know what panic is when you can't find somebody to take care of 12 people? The Riverview facility had no personal protective equipment as of March 20, 2020. They didn't have an isolated area for those with infections, and were asking employees to sign do not disclose papers, one of the complaints alleged. I'm reporting it because it's shameful and wrong to watch people die because of a lack of supplies or proper PPE or greed or proper clean techniques or whatever the hell went wrong and continues to go wrong there, but it needs to end, the nurse said. People are literally dying every shift. In addition, persistent and inadequate staffing levels have been a challenge in nursing homes for years, and it's worse now. We're losing caregivers as the baby boomers age. And we now know that higher levels of staffing are associated with a lower probability of experiencing an outbreak with fewer deaths. Dr. Grabowski, can you elaborate more on your crisis on top of crisis and how real it is?
Absolutely. We've under-resourced nursing homes for a long time. We haven't held them accountable in terms of the quality of care and also who owns the building and how they're spending the money. And then, as you just suggested, there was a trend towards deregulation of nursing homes under the prior administration, especially around infection control. The ranking member outlined some of those steps during his remarks. We were going in the wrong direction. That was the longstanding crisis. When you layered the COVID crisis on top of that, it only magnified the problem. Thanks.
Thank you, Mr. Chair.
I now recognize Ms. Lesko from Arizona for 5 minutes.